Coercive paraphilia, origins and treatments. According to the Diagnostic and Statistical Manual of Mental Disorders, a paraphilia is any intense and persistent sexual interest outside of foreplay and genital stimulation with phenotypically normal consenting adults. Here we will be specifically covering coercive paraphilias, which is any such sexual activity that is non-consensual. There are 4 types of coercive paraphilias that we will be discussing: voyeurism, exhibitionism, zoophilia, and telephone scatologia. In order to be clinically diagnosed for these paraphilic disorders, 2 criterion must be met. First, there must be recurrent, intense, or sexually arousing fantasies, sexual urges, or behaviors. Second, these fantasies, urges, or behaviors must cause significant distress, dysfunction, and/or have been acted on within the past 6 months. The first type of paraphilia is voyeurism, which involves the act of observing non-consenting individuals naked or undressing or engaged in sexual activity. Masturbation can occur during the act of watching or can be accomplished later. According to the DSM, a person with voyeuristic disorder must be at least 18 years of age, as there is difficulty in differentiating it from age-appropriate, puberty-related sexual curiosity and activity. Many times this behavior stems from accidentally witnessing someone naked or undressing, in which a desire to watch for sexual pleasure grows from this experience. The next type of paraphilia is exhibitionism, which is when an individual, usually male, exposes his genitals to others without the latter's consent. Learning theory studies have shown that emotional abuse in childhood and family dysfunction are both significant risk factors in the development of exhibitionism. The next 2 disorders that we will be discussing are considered paraphilias not otherwise specified under the DSM. This is a typically retained diagnosis whose rarity, empirical criterion validation, or symptomatic expression has been insufficient to be codified. The first paraphilia not otherwise specified is zoophilia, which involves the emotional and/or sexual attraction for animals, in which animals are the preferred sexual contact, regardless of what other sexual outlets are available. Oftentimes, the term bestiality is used interchangeably, but it only involves the sexual interaction for the animal without the emotional bond. The animal is merely used as a sexual outlet. This behavior usually begins during adolescence as a transitory phenomenon in which curiosity leads them to persuading the animals to lick their genitals or even engage in intercourse. The last type of paraphilia not otherwise specified is telephone scatologia, which is the making of obscene phone calls to unsuspecting people in which the caller typically gets sexually aroused when their victim reacts in a shocked or horrified manner. This behavior is most common among males, although it can occur with females as well. They are oftentimes emotionally or behaviorally maladjusted and have shown previous signs of sexual abuse. There is limited research on the causes of many of these paraphilic disorders, which makes the findings largely speculative. According to Yaber and Syed, these behaviors may result from some type of interaction among biology, sociocultural norms, and life experiences. People with paraphilia seem to have grown up in dysfunctional environments and had experiences that limited their ability to be sexually stimulated by consensual sexual activity, leading them to obtain arousal through other means. Although these paraphilic disorders are considered difficult to treat, the treatments used can be relatively similar and have been found to help reduce or eliminate the symptoms of the paraphilia. These treatments include cognitive behavioral therapy, in which patients are encouraged to recognize the irrational justifications that they offer for their behavior and to alter other distorted thinking patterns. Psychoanalysis, which tries to spot the traumatic unconscious experience that caused the behavior in the first instance, bringing this unconscious knowledge to conscience and thus enabling the patient to work up his trauma rationally and emotionally. Aversion conditioning, in which the patient is exposed to an unpleasant stimulus while engaging in the targeted behavior, with the goal of creating an aversion to it. Relapse prevention, such as group therapy, which is used to get patients past the denial frequently associated with paraphilias. And lastly, drug therapy, which involves various forms of drugs that alter your hormone levels to help reduce sex drive intensity.